Good afternoon, and this is Dr. Govardhan Reddy, urologist, director of urology and transplant surgery and uro-oncology at Sakra World Hospital, Bangalore. Today, we are discussing regarding the BPH, which is called benign prostatic hyperplasia, and the lifestyle management needed for these patients who have BPH symptoms.
What is the role of lifestyle management in such people?
So lifestyle management is very important. Basically, these are symptoms which can alter their lifestyle. So managing those symptoms is very important. Apart from whatever medicines we give, the patients need to some things from their side. So what are those things? What a patient can do? The patient can definitely see what is his water intake. He can see the limit to which he can take the water. Sometimes most of the symptoms are in the night, what we call as nocturnal frequency. In these patients, we ask them to decrease the water intake or liquid intake after 7 o'clock. So once they do this, they will be able to sleep better. Instead of getting up 3, 4 times, they may reduce to 1 time or 2 times so that their sleep pattern is not disturbed. Other things which can irritate the bladder, some things like coffee, tea, which has this theophylline, caffeine. These are substances which irritate the bladder, and they may also cause frequency and urgency in these patients. Such habits can be reduced so that the irritation of the bladder will be reduced and the frequency urgency symptoms will be reduced. There are also known cases where people who take a different kind of spices also get symptoms of irritation, burning in the urination. So if they can avoid, basically this can be really identified by the patient. So they are the best people who can know which is the irritant which is causing the problem. And if they can identify that and then reduce, then that will be one good thing. Of late, we are seeing a lot of urinary complaints coming from very young population. This young population are those who have had problems with voiding. Basically, they have developed a different style of voiding where there is a delay in urination, where they don't answer the natural call for emptying of the bladder, and they go into meetings and try to hold on urine. So these kind of people will develop the urinary symptoms, which more or less we seen in the elderly group in BPH. So we call this as an bladder neck hypertrophy, and the symptoms can be dyssynergia, that is, there's no coordination between the bladder neck opening and the bladder contraction. So these are the patients who have to relearn where they pass urine, where they answer the call for passing of urine, emptying of the bladder, avoiding excessive fluids during the meeting. So these kind of lifestyles will definitely help in the patients. These are the lifestyle changes which are needed in the patients who have benign prostatic hyperplasia.
Who have symptoms of benign prostatic hyperplasia but hesitate to seek treatment?
So normally, BPH symptoms are seen in patients, basically people who are above 50 years. So a lot of people think it is a normal aging process. They think it is normal where they will have a decreased flow. They attribute everything to the aging. But there are symptoms which more or less are not very limited to the flow. It can be frequency, there can be urgency, there can be irritation, there can be incomplete emptying. So there are various symptoms of BPH. Still, a lot of people, especially people who are illiterate, who are uneducated, who are in rural areas, who are of low socioeconomic status, these are the patients who try to hesitate to seek treatment. Previously, we used to have the problem of shyness, but of late, I think people are more open to know or seek the help if there are symptoms of BPH. So, BPH, as I told, can occur in any person who is above 50, more common in 60s, 70s. There are still many people who try to avoid or hesitate to seek any medical treatment.
What is main concern of the urologist that can affect the treatment of the patient?
The main concern of urologist when treating a patient with the BPH, one is hesitation to seek the help. Another thing is where they may take medicines for some time and stop coming back. There may be no regular follow-up of the patient by the patient. Another concern is in these patients the chances of complications, which are like infections, regular infection, recurrent infection, what we call. Sometimes they may form stones. Sometimes they can have hernias. They can form hemorrhoids, what you call in general term piles. Or some people will go for retention, that is completely unable to pass urine. Or sometimes we do get patients who have neglected the urinary symptoms and where there is a back pressure changes onto the kidney, where their kidney functions are altered. That means their creatinine has increased. So we get many patients who have all these complications. The main concern of the urologist will be to see that patient understands this, that there is going to be a progression of disease, and if neglected it can lead to the complications. So early evaluation, early treatment, regular follow-up will help the patient in avoiding this kind of complication and their consequences.
As an experienced expert, what message would you like to give to patients?
As I told earlier, any patient with urinary symptoms, which can be BPH or something which is related to BPH, these patients need to take the help of the urologist. Most of the time, these can be treated with medicines, with some lifestyle modifications. They may not need surgery. If you take the normal practice, we can say around 90% of the patients who come to us with BPH symptoms either are managed with medicines and some lifestyle changes. Only about 10% of the patient may go in for surgery. Again, one need not be afraid of the surgeries. Previously, for prostate, we used to do an open surgery. Of late, we have changed to minimally invasive. Of that minimally invasive, previously we used to do monopolar or bipolar PRPs. Of late, we have what is called laser treatment. Again, in laser treatment, there is a further advancement in the form of MOSES, which is a good laser surgery, efficient to remove any size prostate in patients who are very young and want to preserve some of the sexual functions. We do have something very simple procedure called urolift, and in patients who are not really fit, not fit to undergo any of these prescribed procedures, they can go for what is called a water vapor therapy or resume therapy. So there are multiple options for the treatment of the BPH. I would like to reiterate that 90% of the patient don't need surgery. 90% of the patient can be managed with medical management. Only about 10% of the patient may need some type of surgical management. And as I told, again, all surgical managements of late are minimally invasive, without any cut, without any hole. So it is done through the urinary passage, and the recovery and outcomes are very good and very satisfying for the patient. Thank you.